Welcome back, everyone, to Awaken America. We're going to be continuing hearing from Martin Lee. So, the floor is yours.
Thank you very much. I'm going to present a series of slides that most of them are just simply science abstracts, summations of scientific research focusing particularly on CBD cannabidiol. I'm going to do this very quickly. Ordinarily, I could dwell on the slides quite a bit. Just to start off, the first slide is from a Brazilian study, Brazilian scientists. The title of the abstract is Safety and Side Effects of CBD, a cannabis sativa constituent, and in the article it concludes, chronic use in high doses are well tolerated in humans. Just to set that first. Now I want to go to the next slide regarding CBD's anti-tumoral effects. This is from the California Pacific Medical Center in San Francisco, has done research on CBD and THC and cancer, and the abstract title, the article title reads, Pathways mediating the effects of CBD on the reduction of breast cancer cell proliferation, invasion, and metastasis. That's from 2010. Also, next slide, from the same research institute. The title of the abstract, CBD enhances the inhibitory effects of THC on human glioblastoma cell proliferation and survival. In other words, THC is found to inhibit brain cancer. CBD, when combined with THC, has a more potent anti-tumoral effect. For breast cancer, they found something similar. CBD, powerful against breast cancer in and of itself, as the previous document showed. THC also has strong anti-tumoral effects with respect to breast cancer, but when combined, they have a more potent effect. Let's look at the next slide. And this is one I think that will be dear to everybody's heart here. This is from Seizure Magazine, 2011. CBD exerts anticonvulsant effects in animal models of temporal lobe and partial seizures. What they do, the scientists, they create animal models of diseases. They can induce a seizure or a seizure syndrome in an animal. They administer CBD before, and they find out it mitigates the seizures. Well, we know that it actually works on children and humans. But this, again, is the preclinical work. And what's very powerful about this, we can show the next slide, is that the preclinical research now that's been going on for really ever since the endocannabinoid system was discovered in the late 80s, or began to be discovered, the discovery stretched over a number of years, the preclinical research powerfully validates the experience of many medical marijuana patients. The next slide. Again, the abstract reads, the non-psychoactive cannabis constituent cannabidiol is an orally effective therapeutic agent in rat chronic inflammatory and neuropathic pain. We know also from clinical trials conducted by GW Pharmaceuticals for their product Sativex, a 1-to-1 mixture of CBD and THC, an under-the-tongue spray. It's been approved for use in over 20 countries for neuropathic pain. That's a very difficult condition to treat. Opiates really don't touch that. It's a different kind of pain than what an opiate would be effective for. Neuropathic pain, cancer patients experience that, AIDS patients, rheumatism, multiple sclerosis. It's pain from damaged nerves in the periphery. And THC dominant strains are very effective for that because THC binds to the peripheral cannabinoid receptor, the CB2 receptor. CB1 is mainly in the brain and the central nervous system. CB2 mainly in the peripheral nervous system and the peripheral organs. THC binds to both. When it binds to the CB2 receptor, it reduces inflammation and pain. But when CBD is part of that, when you have a CBD-rich strain with THC and CBD, CBD has other effects that modulate pain, binding to other receptors in the body. So when the two are together again, it has an enhanced effect. It's that synergy, the entourage that we're referring to. So good for neuropathic pain. Next slide. CBD and diabetes. This is from a study in Israel, 2006. CBD lowers incidence of diabetes in non-obese diabetic mice. They found they would create an animal model of diabetes. They'd administer CBD either before, during, or after, and they find it lowered the incidence of diabetes. Next slide. This is from the British Journal of Pharmacology, 2010, a very preeminent scientific journal. And the title of the abstract, Acute Administration of CBD in Vivo and in Live Animal Suppresses Ischemia-Induced Cardiac Arrhythmias and Reduces Infarct Size when given at reperfusion. What that means, they induce a stroke in an animal But when CBD is administered before the stroke is induced, it reduces the size of the stroke, and it also suppresses heart arrhythmia. Now, heart arrhythmia is a very prevalent condition in our society as people age. CBD suppresses heart arrhythmia. And this was also discussed at a recent paper just a few weeks ago in Italy, new information about CBD suppressing heart arrhythmia. Did you think of the previous two slides? Diabetes and cardiovascular disease. These are two of the most, metabolic syndrome in general, including diabetes. This is two of the most prevalent conditions in our society. And CBD shows great promise for those conditions.